Are they still supporting?
There's a couple of representatives from the state here. If I'd like to call on them to make a comment.
Okay, thanks. Okay.
Good evening. My name is Jean Spratt, 8301 Flat Keystone Drive. I am a dentist. I also work for the North Carolina Oral Health Section as part of the Division of Public Health here in Raleigh. I've been asked by the Wake County Public Health Division to bring the state's perspective on community water fluoridation. When they asked me, they did not provide any guidance on how long I should talk. My prepared remarks are about 5 minutes. Is that acceptable?
Yes.
Okay, I'll go through it quickly. The North Carolina Division of Public Health endorses community water fluoridation as a safe, effective, inexpensive, and equitable way to prevent tooth decay in children and in adults. Tooth decay can be devastating, and it hurts. I've seen children with swollen faces from infected teeth and crying from the pain, and no child should have to endure that, especially when we have such an effective method of prevention in fluoridation. All water has fluoride in it. The fluoride level in Raleigh's water is adjusted to an amount that has been proven to prevent cavities using additives that meet or exceed strict national standards for quality and safety. Fluoridation works. It reduces tooth decay in children and in adults, even with the widespread use of other forms of fluoride like fluoride toothpaste. It is safe. Over the last several decades, many studies have confirmed the safety of fluoride. Leading health and medical organizations agree there is strong evidence that water fluoridation is safe and effective. But you've heard some concerns expressed tonight about claims of possible adverse health effects. And there are claims on some websites whose organizations oppose fluoride and fluoridation, and it does make for scary reading. I've been to some of the websites, and it does create cause for concern. So I understand why people are expressing some of the things that they've said tonight. However, many arguments from anti-fluoride groups and individuals take the credible research and misrepresent it, or they're based on poorly done studies, or on research that is not relevant to community water fluoridation as it's done in the United States. For example, taking results of studies on very high naturally occurring levels of fluoride in the water and applying those findings to the U.S. practice of fluoridation, which provides low and controlled levels of fluoride. As a state organization, the Oral Health Section and the Division of Public Health look to federal organizations such as the Centers for Disease Control and Prevention. And CDC states that the weight of the peer-reviewed scientific evidence does not support an association between water fluoridation and any adverse health effect or systemic disorder. And they've also named community water fluoridation as one of the top 10 public health achievements of the 20th century. The only proven problem that might happen from drinking optimally fluoridated water, the way it's done here in Raleigh, is dental fluorosis. It's typically, in this country, a mild cosmetic condition that leaves faint white streaks on the teeth, usually very subtle, very hard to see, does not hurt affect the health or the function of the teeth. There is recent evidence that suggests mixing infant formula concentrate with fluoridated water for infants that are primarily fed in this manner may increase the chance of that child's developing the faint white markings of mild fluorosis. In the rare instances when we do see the more severe fluorosis, experts think this happens because young children often swallow their toothpaste when they're brushing their teeth, and we do urge parents to supervise their young children when they're brushing their teeth and to use a tiny smear of toothpaste.
You mean I can't eat it anymore? That tastes pretty
No,
good.
I wouldn't if I were you. It does taste good, and that may be part of the problem. Even though we've seen big improvements in reducing decay, there's still major differences in tooth decay rates among different groups of people. That's one of the strengths of fluoridation. It helps reduce the inequities. Tooth decay is more of a problem for low-income people, but with community water fluoridation, everybody benefits, regardless of their income or whether or not they have insurance or if they're able to afford to purchase dental treatment. People benefit from fluoridation without having to spend extra money, but like buying fluoride toothpaste. And in our program, we see kids who don't even have their own toothbrush, let alone be living in a family that can afford to buy toothpaste with fluoride in it. Fluoridation is cost effective. It saves money for families. It saves money for taxpayers. With our tax dollars support public programs like Medicaid. According to the Centers for Disease Control, for most cities, every dollar invested in fluoridation saves about $38 in unnecessary treatment costs to repair cavities. We all want to see our kids have fewer toothaches, so they'll sleep better, so they'll learn better in school, so they'll miss fewer days of school. We want to see adults who can smile with dignity and keep their teeth throughout their lives. Please keep in mind that if the City Council decides to take fluoride out of the water supply, it will result in an increase in tooth decay with the associated increase in cost and in suffering. That will affect and hurt all of us, but it will be especially true for the lower income people in our town. Fluoridation safely protects teeth against tooth decay, and the children and the adults in Raleigh deserve this, and I don't think that we should be depriving our citizens of it.
Yeah,
And
thank
I'll be
you.
happy to answer any questions that you might have or get the answers for you.
No?
Mayor, I think we need to move on. I move approval of maintaining the system we have in place.
Okay. Thank you very much.
Thank you very much. I appreciate your time.
Okay. Any other? No. If you're not on the agenda to speak, then not tonight.
Can we ask questions then? Let's not recall. I'm asking, this is my first time here, so we're asking.
Well,
This is not a public hearing.
it's not a public hearing, so unlike what happened before, this is just people have asked to come before the council and speak and present issues, and we are going through all of those items on the agenda. So it's not a give and take. It's not a public hearing. It's not really a discussion. They present stuff, and then the council decides what they want to do moving forward. Okay, so does this council have any requests to address this? Or okay, hearing none, then we will move on to